right, we are going to go ahead and get started. I have the attendees muted because we're going to try to get through this and then do questions at the end. And I'm going to just wait a minute or two here for more people to sign on. We've got a lot of people sign up for this, so I'm very excited about this. This is our first webinar, actually, and I think it's going to be really informative for all of you. While we're waiting, just a little bit about me. I know most of you know who I am. I'm Dr. Baxter. I am a board certified plastic surgeon, and I've been interested in longevity for really quite a few years. But about the past 6 or 7 years, I've really taken a deep dive into it. I think the science has finally caught up to it and bringing some really interesting options to us now. So I've gotten advanced training in longevity medicine, peptide therapy. I'm bringing that into my practice now and have some things that I really am eager to share with you today. So let me start our slideshow. So here's our agenda. I'm going to describe what I believe longevity medicine is. We need to define it if we're going to talk about it. Um, I'm going to tell you how to really not waste your time and money on things that don't work. There's a lot of things out there, a lot of offerings, and some of them are really worth spending your money on, and some of them are really more questionable and may even have some side effects that you don't want. What this is not is a pitch to sell you vitamins or supplements. That's not how I do my practice. There are some very good things out there, and we're going to talk a little bit about some of those. But my role is really to make recommendations rather than sell them through the practice. So I'm not going to talk about a diet plan, exercise tracking, lifestyle coaching. That is all really important stuff, but not what I'm going to focus on today. What I am going to talk about is what is evidence-based and where are the interventions that we really have good evidence for in terms of reversing aging. We're going to talk also about microplastics. This has become a very interesting topic now that we have ways of measuring microplastics in your body and some potential options for reducing the number of microplastics in the body. So, what is longevity medicine? I describe it as data-driven, personalized healthcare focused on extending healthy lifespan or health span. So we want you to stay healthy and functional and feeling good for as long as possible. This is derived primarily from AI measures of biological age. And so these are machine learning algorithms. It's not just generative AI. These are massive data sets that you can analyze with machine learning to give you an idea of what your biological age is and what you can do about it. So again, the goal is optimized healthcare for as long as possible. And this is really true healthcare, not sickness care. In our system now, we have sickness care. You have to have a disease code in order to get a treatment that you can bill to the insurance. So that is really a diseased care system. What we want to move toward, and I think we are moving toward this, is true healthcare where we're trying to prevent disease by identifying what's happening before you actually have the manifestations of it. So biological age clocks, you can think of them as being like your personal odometer. If you were a used car, you would care more about the miles than the years. And it's kind of the same thing. So it's more the wear and tear on your body that tells how your body is functioning, how you're aging, and predicts how you're going to do in the future. So the best way of measuring this, at least the most common way, is using what's known as epigenetics. This is sort of like the software for your DNA. Every time a gene is activated or suppressed, there's a mark left on it. And one of these is called methylations. So these actually accumulate over your lifetime. And if you think about it, every one of the 2 trillion cells in your body has the exact same DNA. But the reason they can differ in form and function is determined by which genes are active. So if we have a record of gene activation, then we can analyze that. We can count the methylations, we can map them, and if we're training our algorithms on historical samples that have been banked from subjects whose health outcomes are known, then we can identify the patterns that predicted those outcomes. So if we're talking about longevity, we're not talking about doing a study that's going to last 25 years and see how long people live. We have to have another way of measuring it. And so this is how we do it with the epigenetic age clocks. And there are other new ones coming out that are really, really good as well. So the biological age clocks not only predict your health span, but they identify actionable targets and give you a way of measuring the outcomes of the treatments that you're using. So there are a number of them out there. The one that I personally think is the most useful is True Diagnostic. It analyzes the most data. It has now more than 1 million sites on your DNA that it's counting. They publish their algorithms so everybody knows what they're doing. And they're not trying to sell you something else. Most of the other companies out there are tied to an app or a product or something that they want to sell you in addition to this information. And so there's always the concern that maybe their test is geared more toward showing what they're doing rather than just a across the board comprehensive kind of test. So we like the True Diagnostic test the best here. So here's how I think of the kind of overall approach to longevity medicine. We have these foundational things. If you're not doing these, if you're not paying attention there, then nothing else will work as well. So this is exercise, and not just the amount, but the type of exercise that you're getting. Same with sleep, not just how much sleep you're getting, but the quality of your sleep. Dietary strategies, and there's so much to go over there. But basically, it's kind of the same idea. It's not just what you eat, but how you eat and in what intervals. Social engagement, really, really important. Um, Shout out to all my tango friends out there. That's my social community. And then stress management. These are, like I said, foundational things. By the way, I just want to mention for those of you who are just signed on, if you have questions, put them into the chat, and we're going to get to those at the end of the talk, rather than try to get to them as we go along. So then the next tier is things that are more medical. Skin health. Your skin is the largest organ in your body, and you can't have truly healthy skin unless you're systemically healthy. And the reverse is also true. If you're not systemically well, you're not going to have healthy skin. Your skin is communicating with your entire body about the state of your health. And so that is something we really do pay attention to beyond just appearance. A number of supplements have pretty good evidence now. And again, these are things that you really want good guidance on. If you want to know whether it's working or not, you have to have a way of testing it. Prescription medications and peptides, which are prescription medications. There are some things that are becoming increasingly popular there. Metformin, rapamycin, but again, these are things that I think should be medically managed. And hormone replacement is becoming so important in longevity right now. And then the top tier is what I think of as the sort of biotech things, exosomes, gene therapies, epigenetic programming. There's fascinating clinical trial underway with that right now, and plasma exchange, which is being used right now, and we're going to talk about that. So where this all started, the sort of the modern era of longevity medicine, was this study that proved for the first time that you could reverse age. And it was from Horvath's group. He was the developer of one of the first epigenetic age clocks. And they were looking at the effects of the immune system and how it changes with age. And they noticed that the thymus gland tends to get smaller. Most people don't even know where your thymus gland is. It lives in your chest, but it's where T cells come from. And it's really critical to your immune function. So as it shrinks as you get older, your immune function declines as well. And this is actually one of the hallmarks of aging. What they noticed was that in animal studies, growth hormone, which also tends to go down with age, has the potential to restore the thymus gland. So they designed an experiment where they gave a group of subjects, these were men in their 60s, growth hormone and metformin for a year. And they found that they could restore thymus function, restore immune function, but most importantly, they reversed epigenetic age by 2 years. So this was the first time that it was proven that you could actually reverse your biological age. So an alternative, now we don't use growth hormone, at least not very much in the US, is highly restricted. It has off-target effects. One thing, for example, is that it tends to elevate blood sugar levels. It's sort of a diabetogenic effect. And so instead, we use growth hormone releasing peptides, sermorelin, CJC 1295. There's a whole range of these. We also do like to use them with metformin, but for different reasons. Um, this is an approach that also helps maintain muscle mass during weight loss, so very helpful there. Amplifies the results from your exercise and diet. So again, these are natural, semi-natural approaches sometimes, and it helps recovery after surgery. So we have a whole peptide program that we use in our patients to help recover from surgery. So just about peptides in general, they are prescription medications. They are usually given by injection. Most of them are not FDA approved. Now, that's not the same as that they've been applied for approval and rejected. They've just never been applied for in many cases. And part of the reason is that many of them occur naturally in the human body already. So it's perfectly appropriate to use them, but you really do have to know what you're doing. In our case, we only prescribe to US licensed compounding pharmacies. You can order these things online. They will come labeled not for human use or something like that. So you're taking a chance, basically. So I would recommend work with a longevity medicine specialist and get good advice and track your results. So right now we have what I think of as sort of this wild west in longevity medicine. It's just exploded in interest and all the offerings out there, and everybody's talking about all these things, and they're all trending and they're all interesting. And many of these things are things that I either do personally or we recommend them in my practice, and they have reasonable level of evidence for a lot of these things. But if you start narrowing them down by what is the level one evidence, and level one is a very specific thing in medicine. This means it's been through a randomized, prospective, controlled clinical trial. And so the control means that if it's a drug or a supplement trial, for example, it's compared to a placebo. If it's a procedure, it's compared to a sham treatment. So this gives you the best, highest quality, objective evidence of what's working. So in terms of procedures that you can do, it starts to kind of narrow this field down pretty quickly. And again, I don't mean to dismiss too many of these things. A lot of them really have pretty good evidence for effectiveness. But if you're looking for true level one evidence for a procedure, what you end up with is something called therapeutic plasma exchange, or TPE. So let's talk about that for a moment. This is very interesting because this is the only procedure proven in a prospective, randomized, blinded clinical trial to reverse aging biomarkers, to make you biologically younger. And I want to just kind of rest on that for a moment, because if you think through the entire course of human history, this is the first time anybody's been able to say that and prove it. So this is a real pivotal moment, I think. So what is it? It's a type of plasmapheresis, which is a technique that's been around for a long time. It's also being studied, interestingly, for clearance of microplastics. And so we're going to talk about that a little bit. Treatment of Alzheimer's disease. There's a trial going on with that right now. Very interesting stuff. Long COVID, a range of other conditions. So this is a really interesting procedure. The longevity protocol was developed by a Seattle-based company called Circulate, and this is a proprietary protocol. It's been published, so everybody knows exactly what's being done, but it is their proprietary protocol, and they're the ones that are behind this current study. So how did we get here? There's this weird science of age reversal that goes back to experiments where the circulatory systems of two genetically compatible animals were temporarily connected to see what would happen when they exchanged their blood plasma. When a young animal was connected to an old animal, what happened was the young animal started aging faster. The old animal started getting younger. So something in the old plasma could be driving aging faster in the younger animal and vice versa. So the idea of TPE is to take out those toxins, all those things in the plasma that are driving your aging faster, and replace them with young fluid. Um, your plasma is discarded. You can think of it as like an oil change, but it's removing toxins, potentially microplastics, all the inflammatory factors that are driving aging and disease, and your own blood cells are, of course, returned to you. Um, so I wanted to mention again just for a second. So we'll do the questions at the end. So put them in the text. We're also going to have a drawing at the end, by the way. There's going to be some really interesting giveaways here. So you want to stay around till the end. Um, don't miss out on that. So the TPE experience is very comfortable. It takes about 2 hours or so typically. It's relaxing, low stress environment. It is performed by the Circulate professionals. So these are highly experienced people. So this is the results of that study I mentioned from the publication. This was a peer-reviewed publication, really validated stuff. So all the blue is the results from the treatment. Red is from the control group. You can see blood toxins reduced, inflammation reduced, different biological age clocks all reversed backwards, all a whole range of different aging pathways also looked at. Now this was a specific protocol with 6 treatment sessions. So I've had it done. My results I found very encouraging. After only 3 sessions, I reversed my biological age by 4.3 years. This was using the True Diagnostic Test, so the best, most comprehensive test, in my opinion. And I actually feel stronger. I've gained muscle mass. I'm really happy about those results. Also, my rate of aging, which is another measure that they derive from this, slowed from 0.8, meaning I was aging 20% slower than other people of my age, down to 0.76. So I'm only aging 3 years for every 4. But I really want to get that lower if I can. So the 0.8, I was doing a little better based on all the other things I was doing, all the other things that we kind of took away because they didn't have the highest level evidence, but doing all those things in addition to exercise and so forth. So I would like to share with you my microplastics results, but I can't. The company has done a study. They have it in peer review right now. It'll come out in publication very soon. It is highly anticipated. So we can't really talk about the results of that study until it's kind of cleared peer review and is available. But we do want to think about microplastics because this is a huge problem worldwide. Obviously, not just in the environment. Microplastics are accumulating in our bodies. They are in our brain, in our liver. They're throughout the body, and they are associated with, now we don't have hardcore cause-effect evidence for all of these things, but there are strong correlations with cancer, metabolic disorders, immune dysfunction, um, inflammation, cardiovascular disease, on down the line. So we know that microplastics are just wreaking havoc in the body. They are driving aging, and whatever we can do to clear them, reduce our microplastics counts in the body is going to be helpful. We'll talk just a little bit more about that in a second. So here's just a kind of general summary. Highest level evidence right now is therapeutic plasma exchange. Moderate level evidence, hyperbaric oxygen. I know we have some professionals on who are very interested in this. I will say that it is something that is extremely helpful for people recovering from surgery or injury. This is a really great technology. What I've seen recently is some interesting studies using what's known as the hard chamber, where they vary the oxygen pressure. You go up and then you go down because it's that signal of change that drives the response to it that you want in terms of longevity. So I think hyperbaric is probably going to move up to level 1, at least the way I look at it, very soon. But again, that's like with the Circulate, it's a specific protocol. A lot of other great applications for it, but for longevity, looking at aging biomarkers specifically, it's almost there. NR supplements. So if you're not familiar with NAD and this whole thing, it's a little bit much to unpack right now, but this is nicotinamide riboside. It's a precursor molecule for NAD, which you need in your cells, really important to resist aging. They're cofactors that work with sirtuins for all of the longevity genes. So you really want high NAD levels in your cells because they tend to decline with age. The issue is that you can't just infuse NAD and it goes directly into the cells. It actually has to break down into its precursor, NR, in order to get into the cell, then is reconstituted as NAD. So that's why over in the other column there, I put NAD infusions as having low-level evidence because you can do it with NR infusions now or supplements, but the infusions are just recently become available. So that's good news there. But even worse with NAD, when it's given as an infusion, it has a different effect. It is actually a signal of inflammation. So if you have NAD circulating as opposed to in your cells, it's a signal to your body that you're in a state of inflammation. And they find that actually your white blood cell count goes up and really not the effect that you're looking for. Rapamycin is another one that, again, we don't have a lot of time to go into that, except to say that if you're doing that, you do need to have the brand name sirolimus. In the clinical trials that are being done with it, they had a lot of difficulty. They were using it from a compounding pharmacy, and they found just huge variation in the level of bioavailability and what was actually being absorbed. When they switched to sirolimus, which is the FDA-approved brand, they got much more consistent results from it. So that's easy to do, but just don't take a shortcut there. Metformin used quite a lot now. There's an alternative that comes from Chinese herbal medicine called berberine. Berberine has pretty poor bioavailability, so there's a derivative called dihydroberberine that seems to work a lot better. So if you're looking for an alternative to metformin, get dihydroberberine. That's the one I recommend. And again, peptides. There are so many peptides. You can't just say peptides are good or peptides are bad, or if something has peptides in it, it's good. There's so many of them. You really have to know what you're doing with them to get the maximal benefit from them. Don't be tempted to just order stuff online and assume it's the same. It might be, it might not. Hormone replacement therapy, that's another one that I might actually move up to level 1 evidence. It's kind of on its way up pretty quickly because this is increasingly being recognized as pro-longevity intervention, not just quality of life issue. So other supplements, alpha-ketoglutarate, urolithin, spermidine, these are all very, very useful things. Hard to find controlled clinical trials versus placebo, but really pretty good evidence, and I support the use of those. So stem cells. Stem cells I think of as being in the context of regenerative medicine. And I think most of the good applications for stem cell therapies are in that category rather than for longevity in general. If you're looking to reverse your biological age, it's really hard to find a stem cell study that validates that concept. So I actually would put that probably down in the experimental category as far as a longevity intervention goes. But who knows? Now, experimental, interestingly, stem cell therapies probably are working by giving messages to the tissues in the form of exosomes. So exosome therapies, a lot of people are familiar with this in skincare, but the interesting stuff might actually be from intravenous, not an FDA-approved indication right now. So be careful about that. But I think there's some fascinating potential there. Epigenetic reprogramming, there is a clinical trial going on. Again, that might be more of a regenerative medicine thing. And gene therapy, this is where you're actually given a copy of a gene that you want the body to make more of. For example, something called follistatin, which tends to promote muscle mass and resist that loss of muscle that you get with age, and something called clotho, which is fascinating. Again, that might be a talk for another time. So resources, go to circulate.health if you want information about therapeutic plasma exchange. You can get some great information there. Follow us at Phase Plastic Surgery. Look up the Buck Institute. They were a co-sponsor of this study. They do so much fascinating work in longevity, very credible resource for a lot of this stuff. And I have this book, Biohacking Longevity. You just download it. There's a QR code, or you can find it on my website, drbaxter.com. I update it probably once a month because the things are just changing so fast, and it's just a good sort of current overview of what's going on in longevity. So plastic talks. You can't really know what's going on with microplastics in your body unless you can measure them. And so we can do that now with these plastic tox kits. This is just a blood spot test, but we like you to come into the office to have it done. And then once you know, then we can have a discussion about maybe what some of the options are if it's of a concern.